Okay, in today's video, what I'd really like to do is highlight the value that I place on the role of bodywork in conjunction with infant tongue-tie release. So when we discuss bodywork, what we're really referring to is a light manual therapy to gently unwind any restrictions in a baby's head, neck, and body. And these restrictions, they may have occurred from their in utero position, their passage through the birth canal, or medical interventions such as forceps, inductions, vacuums, and C-sections. So normally the people that offer bodywork are those craniofacial, cranial osteopaths, chiropractors, and craniosacral therapists. And there are 5 key reasons why I think it's particularly important to have this addressed before we look at tongue-tie surgery. So the first is that being able to release these body restrictions can actually help with a baby's comfort. And so what we find is that sometimes when babies can turn their head a certain way or position more comfortably, that can actually be one piece of the puzzle to help improve their latch and feeding. Secondly, because the tongue is connected down through all the midline structures, all the way to the toes, through a connective tissue called fascia, when one area is tight, it actually restricts the mobility of more distant structures. So when we can actually release these body tensions, it can actually help with improved tongue mobility. And so having these pre-release of tongue-tie release actually gives us a better indication of the true mobility of the tongue. The third reason is that one of the areas that we are particularly interested in is the join between the head and the neck region, because there are very important cranial nerves that are involved with suck, swallow, breathing, and mobility of the tongue that run through this area, and these nerves can be impinged when we have compression in that area. So having these released means that we can ensure that things will function more optimally when we have the improved tongue mobility. Now, the fourth reason is that, generally speaking, babies tend to be more calm and relaxed, and they have reduced sympathetic nervous system activity when we have this bodywork done. And so what this helps ensure is that we're going to have a more comfortable baby and easier to work on and access their mouth when we do the procedure, and also for you as parents to be able to have a more calmer and easier to manage baby post-release. And lastly, or fifthly, my other reason why I like the bodywork is that I perceive that the more tension we can reduce, particularly in the head and neck region, the less risk that we have of excessive reattachment or rejoining of the wound. I think we can get better healing when the tissues are nice and soft and relaxed. So of course, it's always a fine balance between optimal timing and the urgency of your feeding issues. And it is something that I take into consideration as well as the people that I work with. So what I'm going to suggest is, in the first instance, to go ahead and have your initial evaluation and get that ball rolling. We have a list of providers in our initial email that we work with fairly regularly and that we can rely on to help support you. And of course, there may be others that we're not as familiar with that may be able to help also. If you have any questions or you want to know a little bit more, please feel free to contact our team and we'll be able to address those for you.